Screening Project is a community-based initiative that we're looking to put screening within the community to help identify those who have diabetes and connect them with care that we know that they need, and just build that awareness piece around diabetes prevention, awareness, and management.
The challenge that we're facing, and we have many individuals, particularly from underserved communities, who don't have access to a primary care provider. We are missing many cases of undiagnosed diabetes in the community.
So this is very important because diabetes is on the rise. Moreover, among the Black community, they are disproportionately affected by diabetes.
In phase 2, we're going to take the screening to the community. And what that will involve is a mobile van and several pop-ups that's going to be around Mississauga and Brampton.
So we'll be taking this van to community events, to mosques, to churches, where we can provide screening for individuals.
It's like a mini clinic inside a van that you walk in, and there will be individuals who will do the testing, they'll do the referral to primary care providers.
You can give that result right away, and you can kind of let them know, this is where you are right now.
The major goal of this program is prevention, because with prevention, we don't have to invest too much money into treating complication. And complication can be very difficult for the patients, for their families, and even for the government, because the economic impact of diabetes is huge.
Eventually, when individuals do enter the healthcare system, it's often too late because they already have diabetes or have been living with diabetes for a number of years. And now we're dealing with complications. So it's more of a reactive response versus our project is trying to adopt a more proactive response to do early detection and prompt early prevention for diabetes and potential complications.
Our Staying Active Plus project is all about helping community-dwelling adults living with psychosis become healthier, more active in service of preventing diabetes.
For the psychosis outpatient program, we recognize the importance of having a program that would address the physical health needs of our clients, the socialization needs, which are very important as well, and the food and diet needs and issues that they would face.
Adults living with psychosis are at risk of dying 10 to 15 years sooner than their peers in the general population.
This approach is different from traditional care because it really takes more of a holistic approach. And I think what's great about it is that we get to use the community and the outdoor spaces like the parks and our local library as the backdrop for treatment.
For me in particular, I had help right away, and I think that made a huge difference on my, mental health journey and, recovering.
People have identified being active and being fit as painful and hard. The purpose of our program is to really show that it can be fun. And I think Yoga Fit is a great example of that it's a way to gently ease in, have some movement that's also relaxing.
They're looking for freedom of movement, they're looking for socialization, they want to feel better. And I think because they've made the conscious decision to attend, there's a desire to be with other people because they could practice any of this in the comfort of their own home.
Whenever motivation is low, it affects memory and concentration. So we're thinking to bring activity here in the program with patients. Similarly, walks or physical activities can improve concentration and memory, and people start retaining information better. And when they go home, actually, they start practicing them.
We often are wanting people to return to a level of life that they're satisfied with, that they can feel good about themselves again. And we don't realize that many of them already hold the keys and the secrets, and that sometimes if we don't get creative and show initiative, we can miss those opportunities to let people cook for a group of people, to let people lead an exercise, to let someone start throwing a Frisbee around. He hasn't thrown a Frisbee for 30 years or something, and he's just delighted at the opportunity to do something that you don't otherwise get to see within a clinic.
I really hope that when community members see this story, they are more understanding of the life circumstances of people living with psychosis and accepting that these are wonderful people with many talents who at times have been sidelined by the symptoms of their disease, but who can and do recover, because when we all thrive, we all thrive.
Our community garden brings seniors in their 60s together with youth.
And the idea is to run an intergenerational community garden that centers Black older adults and youth to be able to address the burden of type 2 diabetes, social isolation.
And to grow food together in their communities.
Community gardening can actually modify a lot of the risk factors associated with type 2 diabetes, especially for youth and older adults.
Well, we took an Afrocentric approach to healthcare. We think about how talking circles and, sitting under a tree and learning from your elders, that is traditional to many cultures in the African Caribbean Black diaspora.
I learned so much in that program, and what excited me, it was catered to Black people.
Our main goal is for Black communities in Peel to be able to live healthy and thriving lives where type 2 diabetes and social isolation is no longer a challenge, and people do not have to choose between their health and their food and culture.
It's not just the garden in itself. I think there's something really beautiful about food. I work for a food bank, and we're always saying food is the thing that brings people together. The people behind it, the people who are participating, I think there's something really beautiful about the intergenerational bonds that are being built.
To teach us how to eat from the land.
But if you talk about why it is important to eat food and how you can make their food that they love healthier, that is the magic. And that is how we can make a difference in the populations that we serve.
This is something I think should go far and wide. It's in Peel, but it has to cross the border and go further. It's a learning tool, it's informative, and plus it's fun. We just love it.